Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. In my most recent video, I talked about conditions that patients complain of that really don't help their disability application. I'm going to go to the flip side today and talk about conditions patients often leave out that would help their disability claim. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, to begin, it's important to understand how Social Security evaluates a disability claim. Some patients have only one medical problem, typically a stroke. However, the majority of patients have more than one problem. For example, a person may have neck problems, low back problems, problems with their shoulder, and problems with their knee. In the case of multiple problems, Social Security has a formula which they keep secret on how to add up each individual problem, and then when they've all been added together, determine if the patient meets their criteria for disability or not. Because of that, it's very important to list every single problem that you have that can contribute to your disability claim. When I do Social Security disability exams, that's all I do for one day. And every single time I do them, I get at least one person who's forgotten about or hasn't thought of a medical problem they have that would contribute to their disability claim. So what sort of problems are these? Well, by far the most common are orthopedic issues, problems with the bones, muscles, and joints. What I think happens is that the patient has an injury or develops a problem with a muscle, bone, or joint, and after a while they get used to it and adapt to it, and they literally forget about it. So when it comes time to apply for disability, they don't even mention it. And the most common issues I see are, number one, problems with the shoulder. For example, someone who can't lift their arm any higher than this. Social Security includes the ability to work overhead as one of their criteria for disability. And if you can't raise your arm higher than that because of a shoulder problem, that contributes to a disability claim. The second most common orthopedic problem I see are problems with the hands and fingers. Typically an old injury where a finger has been broken or twisted and never healed right, and now it's stiff or won't move properly. Any finger injury contributes to your ability to lift, carry, and handle objects, which are all criteria Social Security is very interested in, especially if the injury or problem is with the index finger and the thumb, and especially if that's in your dominant hand. So don't omit any hand or finger problems. Now, the next issue are problems with the lungs and heart. Social Security considers shortness of breath very important, and most people with shortness of breath get worse if they exert themselves. Now, a lot of people will tell me I get short of breath if I work too hard. Well, that's helpful, but it really doesn't give me or Social Security any idea of how bad the shortness of breath is. Doctors evaluate shortness of breath two ways. One, how many flights of stairs a person can climb without having to stop to catch their breath. 3 being fine, 2 being maybe a little short of breath, 1 being short of breath, and less than 1 flight of stairs, quite short of breath. If you can determine how many stairs you can climb before you have to stop, that's very helpful to your claim. The other issue is patients who have heart disease and get chest pain. Again, just saying I get chest pain isn't really helpful because there are all sorts of causes of chest pain. Everything from trivial and completely harmless that don't interfere with your ability to work at all, to very serious heart disease that definitely limits your ability to work. So when talking about chest pain, you want to know, where is it located? Does it spread anywhere? What brings it on, if anything? What relieves it, if anything? And how long does it last? Seconds, minutes, or hours? And how many seconds, minutes, or hours? Those are all very important criteria to know if you have shortness of breath or if you get chest pain. The next problem that I see people forgetting about is loss of sensory function. This can be loss of vision, usually in one eye, where the patient can see fine out of one eye but has very low vision or is completely blind in the other. That's considered significant by Social Security. Or hearing problems. Is the person hard of hearing, or are they completely deaf in one ear? If you have trouble hearing, if you have bad ringing in your ears, which doctors call tinnitus, be sure to include those problems. Then the final issue that I often see patients omit or forget about is problems with balance. If you have impaired balance, that limits the jobs you can do. For example, you can't work on a roof or on a high ladder if you have impaired balance. I'd say probably 1/4 to 1/3 of the folks who I find on exam have impaired balance. Don't mention it until I've examined them. So, to recap, keep in mind the abilities Social Security is always interested in. The abilities to sit, stand, walk, lift, carry, handle objects, speak, travel, understand, remember, concentrate, persist, interact socially, and adapt, and also to see and to hear. If you have any problems, even if they seem minor, that affect any of those abilities, be sure to include them in your Social Security disability claim. And always remember, if it happens, it's possible.